Good morning and welcome back. It is now 6:09 on this very cool morning that is going to get more and more blustery. And this time of year, of course, everybody thinking about their health as we get on into the flu season, and along with that interaction with more and more people with the holiday seasons coming up. So we definitely want to keep track of our health, and to help us do that, some programs coming up here in Amarillo that you might want to know about. And joining me this morning is Dr. Richard Jordan. He is the dean at Texas Tech of the medical school and the medical school there, and we've got a program coming up that I think folks will be interested in knowing about to help with our health, I guess. Give us some information on what you got going on.
Well, we have a series of presentations that we put on as a service for the community. We call it the Community Medical School. We're trying to make doctors out of everybody.
Okay.
And this next Tuesday, November the 8th, the presentation will be on adult vaccinations. Mm-hmm. We often are very careful about our children, right, but we overlook ourselves. And this will be at the medical school on Coulter. Mm-hmm. The presentation will start at 6. We'll have snacks, free snacks, mm-hmm, free to the public. The presentation from 5:30 to 6. There will be health screenings for blood pressure, for blood glucose, mm-hmm, and most interestingly, and I think people will find this helpful, we're going to be giving influenza vaccines. Okay. And it's at $15, which I don't think there is a less expensive place that you can get flu vaccinations. That actually is
a pretty good deal, almost half from what you might get in other locations, so not bad. Now, as far as adult vaccinations, what do you see as adults kind of not keeping track of in the vaccinations they should be getting?
Well, they don't get their pneumonia vaccinations and pneumococcal vaccinations. We all need a second one after age 65. There's herpes zoster that it's relatively new that people aren't aware of, that adults need to get as they get older. Then there's the diphtheria and the tetanus that's overlooked.
Yeah, tetanus for sure.
And also, if you're going to travel, there are some vaccinations that are very important to give. And Dr. Faisal Kasani is going to give this presentation, and he's a certified specialist in infectious disease as well as critical care.
Are we seeing a trend in any of these diseases that have kind of spiked back up a little bit without the adults getting these vaccinations?
Well, we do see occasional pockets of diphtheria. It's not a huge health problem, but it's certainly one that's avoidable. Herpes zoster can cause very painful blisters and eruptions on the body, and so this can be greatly reduced with this vaccine. Of course, pneumonia is pneumococcal pneumonia is something that does still kill adults.
Right. So we don't want to spike any of those. We want to keep vaccinated, keep track of that. Dr. Jordan, thank you very much for being with us here this morning.
For letting me be here.
And again, it's coming up this Tuesday?
Next Tuesday at 6 o'clock, and then health screenings from 5:30 to 6 before the presentation.
It's free. No reason you can't take advantage of that.
Influenza vaccines, $15.
Excellent. All right. Thank you very much. We'll be back with more right after this.